Hello doctors, welcome back. Following the series of osteology of the upper limb, previously we have discussed osteology of the clavicle bone, scapula bone and the humerus bone. Today in this video lecture we will discuss the osteology of the bones in the forearm region. In the forearm region we have two bones. One lies laterally, which is radius bone, and another lies medially, which is ulna bone. First we will discuss the osteology of the radius bone. The radius bone lies on the lateral side of the forearm. Proximally it articulates with the capitulum of the humerus bone and with the radial notch of the ulna bone, while distally it articulates with the head of the ulna bone and the bones of the carpal. Now moving toward the bony features of the radius bone. Lies on the lateral side. Okay. Proximally, as we have already said, it articulates with the capitulum of humerus bone and radial notch of ulna bone, while distally it articulates with the head of the ulna bone and carpal bones, scaphoid and lunate. These two bones are the carpal bones. Now moving toward the bony features. In the radius bone we have head followed by neck, radial tuberosity, interosseous border, ulnar notch and styloid process. The head, neck and the radial tuberosity lies at the proximal extremities. While the interosseous border lies at the shaft or body of the radius bone. The ulnar notch and the styloid process lies at the distal extremities. This is the radius bone. Proximally it articulates with the humerus bone and the ulna bone. Distally it articulates with the ulna bone and the carpal bones. Now proximally this small round surface shape is called the head of the radius bone. Now followed by the head, this region is called neck of the radius bone. The head of the radius bone form articulation with the capitulum of the humerus bone, while medially the head also articulates with the radial notch of the ulna bone. This area is the As you can see, this slight depression, this is the radial notch. Here the medial side of the head of the radius articulate, just like this. This is the head of the radius bone, and medially this articulate with the radial notch of the ulnar bone, while proximally it articulate with the capitulum of the humerus bone. Distally to the head of the radius bone, we have neck region, and more distally at the anteromedial side, we have a slight rough elevation. This elevation is called radial tuberosity. This radial tuberosity provide attachment for the tendon of the bicep brachii muscles. Body of the radius bone. Medially we have a sharp crest. This sharp crest is called interosseous border. As you can see, this sharp crest, this narrow sharp crest is called interosseous border. This interosseous border provide attachment for the interosseous membrane. The interosseous membrane is present between the radius and the ulnar bone, and it held together the radius bone and the ulnar bone. Now moving toward the distal extremities. In the distal extremities, at the medial side of the radial bone, we have a slight depression which is called ulnar notch. At this area, the head of the ulna articulates. As you can see, this is the head of the ulna, and it articulates here at the ulnar notch of the radius bone. Okay. Then at the lateral side of the radius bone, we have a process which is called styloid process. This area is called styloid process. The distal articulating surface here, this area is called distal articulating surface, as this take part in the articulation formation of the joint. The lateral side of the articulating surface articulate with the scaphoid bone, while the medial side of the articulating surface, it articulate with the lunate bone. The scaphoid and the lunate bone are the carpal bones. So this was all about the osteology of the radius bone. Students, now moving toward the ulnar bone. The ulnar bone proximally articulate with the trochlea of the humerus bone, and also with the radius bone, while distally it only articulate with the radius bone, as you can see. Now moving toward the bony features of the ulnar bones. Ulnar bone. The ulnar bone lies on the medial side of the forearm, proximally articulate with trochlea of humerus bone and head of radius bone. Distally, it only articulate with the radius bone. Ulnar notch of radius bone. Now moving toward the bony features of the ulnar bone. The ulnar bone has olecranon process, coronoid process, trochlear notch, ulnar tuberosity. And again same in the radius interosseous border. Head and styloid process. Students, the olecranon process, coronoid process, the trochlear notch, and the ulnar tuberosity all lies at the proximal extremities. Olecranon process, coronoid process, the trochlear notch, and the ulnar tuberosity. While the interosseous border lies in the body or shaft of the ulnar bone. The head and the styloid process lies in the distal extremities. This is the ulnar bone, the proximal extremity of the ulnar bone. The ulnar bone, this process the most proximally, this is the olecranon process. Here, this is the olecranon process. While anteriorly this process here, this is called coronoid process, and the notch formed by the olecranon process and the coronoid process, this is called trochlear notch. By lateral view, this is called the olecranon process, and this is the coronoid process, and the notch formed by the olecranon process and the coronoid process is called trochlear notch. The olecranon process fixed into the olecranon fossa of the humerus bone, as you can see here. We will move posteriorly. This is the olecranon process, and this fossa here we have already discussed. This fossa here, it is called olecranon fossa, and the olecranon process of the ulnar bone fixed into it. While anteriorly this is the coronoid process. Now students, laterally this depression here, it is called radial notch. Here it articulates with the head of the radius bone. Now moving distally, this slight rough elevation here, this is called ulnar tuberosity. So these are all the bony features in the proximal extremities. One is olecranon process, coronoid process, which is located anteriorly. The notch formed by these two is called trochlear notch, while on the laterally the slight depression here, this is called radial notch, which form articulation with the radius bone, and distally to it, this slight rough elevation is called ulnar tuberosity. Now moving toward the body or the shaft of the ulnar bone, This laterally sharp crust here, it is called interosseous border, and same this also provide attachment for the interosseous membrane. The interosseous membrane held the ulna and the radius bone together. Now moving toward the distal extremities of the ulna bone. In the ulna bone, the head of the ulna bone is present in the distal extremities, while the head of the radius bone is present on the proximal extremities. So this is the head of the ulnar bone. This head of the ulnar bone laterally articulate with the ulnar notch of the ulnar notch of the radius. Here this area is this depression, slight depression here. This is the ulnar notch. Here the head of the ulna articulates. Now medially, the ulnar bone has a process which is called styloid process. So these all are the bony features of the radius and the ulnar bones.